All right, time for our last daily briefing of this week, Friday, the 16th of October, and there are some things to go over. Very slight uptick in cases. There was one that made the dashboard and then one more that didn't, because it was discovered after the dashboard update. So we either have 11 or 12 active residents, or it would be 2 or 3 active non-residents, but the total is 14 as of this recording. We talked to Dr. Sanders and City Manager Howarth today to get two perspectives on where we're at and where we're headed. And you are hearing this on the radio in either the 1, 5, or 8 p.m. hour or online at youtube.com/Cordova TV. Glad to have you with us here, and we'll see what our experts have to say. So, Doctor, we head into another weekend. Things were sort of flat-ish through the week, and then a bit of an uptick. What are we looking at going in to the next couple of days?
Yeah, well, the testing has identified 2 more cases that were part of our state testing that was sent out on Tuesday. So at this point, we have roughly 20 or 30 tests pending at the state. We expect maybe a very small number of them to be positive. We're not expecting a large number of positives out of those cases. We're seeing that the cases seem to be flat and or maybe declining. I think that people's behaviors are really helping to curb the spread of the case cluster that we're seeing here in Cordova.
Okay, and when you refer to a case cluster, does it still seem, to the extent it's possible to tell through the contact tracing process, does it still seem like the cases are isolated to those, or is there any indication it's getting more random and more widespread?
Most of our contact tracing is being done by the state health nurse, although here locally the medical response team does participate in some of the cases, particularly the high risk or any that could potentially be related to the schools, which at this point we have had none related to the schools. So I had a meeting yesterday with one of the state epidemiologists, our state public health nurse, the school district, as well as one of the doctors that's representing the school district, Dr. Olson, for the state, not the school district, but working with the state's Smart Start plan. And it is felt by everyone that these cases are all closely related to an initial cluster or case that came into Cordova just over 2 weeks ago. And we don't expect or feel that there is a widespread outbreak. Particularly, we feel this because we have tested over 10% of our population in Cordova over the last week, and we're not seeing any other random cases pop up.
Okay. Well, that part is certainly encouraging. I see that we're still at the yellow level. It doesn't sound like things have ascended to the point that we might be looking at one of our red alerts.
Yeah, it's not. I think that right now we're really still in that yellow watch phase, and we expect to probably continue there for some time. Part of that meeting with the state yesterday was to review our mitigation plans that we have in place, make sure that we are certainly doing best practices and that the state is in agreement with our plans. And they continue to help us review and look, and we're getting very good feedback that Cordova's plans and mitigation strategies seem to be very effective, and we get a lot of accolades for the plans that we have. I think our implementation of those plans has also been excellent. I really want to commend all of the teachers and schools as they're just doing an excellent job.
Good. Well, we have to continue to acknowledge the reality. It was tough news. I saw in one of the reports this morning there had been a fatality in Valdez. So while we're certainly trying to do our thing here, having it get loose, it was a female in her 80s, and they don't give out more details than that. But that's been the greatest fear. Obviously, is we'd love to come away with this come away from this without losing anybody. So as we go into another weekend, what do you want folks to know?
Well, I want people to know that we have had a lot of time to prepare for this at the hospital. We have geared up our equipment. We have ventilators here in Cordova. And although we do expect that everybody continues to help us mitigate and continue the social distancing and mask wearing, that really helps support the medical community and not having to deal with too many cases. If you need help at the hospital, we're here and ready to take care of you.
All right. Well, best we could ask for, and thank you for the time. Hope you have a great weekend. Turning to City Manager Howarth, nice to have you with us. What's kind of give us your review of the week and what's important as we had our uptick, we flattened, we're up a little bit here going into the weekend with a couple new cases. So what are you thinking?
Well, I think the last 2 weeks have been really informative for everyone. Number one, I think communities should be really comfortable that we have systems in place. Our mitigation methods are working. But we can only keep COVID out if individuals personally take responsibility for, doing their part. So I think everyone got a little wake-up call. And I'm hoping that we're going to see the numbers go back down to zero, and we'll all be comfortable again. But it just, sometimes we need a little knock on the side of the head to say, hey, don't forget.
Yeah.
And I think we've had that over the last couple of weeks.
Well, and as I was telling Hannah just a little bit earlier, the news of a fatality in Valdez is another one of those. I mean, it was reported as a female Valdez resident in her 80s. So yeah, I mean, it's there, it's around. We need to be aware.
Yeah, and I think it's really easy. We're all tired of this. We talk about COVID fatigue. I don't think there's a person on the planet that doesn't have that, wishes this was over.
Yeah.
But the only way for us to say we can beat it and it will be over is if we all do our part. So again, just a reminder to everyone, City has put in place, with the emergency management team, has put in place really great systems, from testing to airport to, communication, to make sure that the resources are on the ground for community to be safe, but we all have to participate. So that's where we are. That said, things are changing. So the state of Alaska just announced that they're loosening the travel restrictions for individuals arriving into the state from out of state. So whether you're a resident who's been traveling out of state coming back in, or whether you're an out-of-state person coming in for visiting or whatever, there has been a rule that you had to test before you got to come in, or test as soon as you got in quarantine until you got that test. And then you had to test 7 days later. And it was they've loosened that restriction. So the testing for in-state, to arrive in state, is still on the ground, but you don't have to have that second test 7 days later. And every single time the state makes a change, I realize that the community itself, it's like, it can be very confusing. What are the current rules? So the Department of Health and Human Services at the state, who is managing the state's pandemic response, has said, we will be available to come and talk to your community. So we've made arrangements for Commissioner Crum, who is head of Department of Health and Human Services and manages the whole pandemic response. And his team, members of his team, will be at City Council meeting next Wednesday at 7 o'clock to share information. So we're really looking forward to that as a way for the community to feel a little bit better about what the state is doing and how we are doing. So that'll be a great conversation. And other than that, it's a long weekend. It's a beautiful weekend, and hopefully everyone will remember to keep within their personal bubbles and do the best they can to follow all the safety protocols.
All right. Well, thank you for the time, and always good to chat with you.
Yes, thank you. Enjoy your weekend, all.
All right, another visit with two of our local emergency management experts, Dr. Sanders, City Manager Helen Howarth, closing out the week here with, again, a slight uptick in cases. There is one more that has been identified than shows on the dashboard because it came in a little later in the day. Again, we're not sure if it's a resident or non-resident, but the total active case count right now is 14. And it's managing to stay fairly level. It's, again, it doesn't seem to be sort of random. All of these cases appear to be tied to a particular event or a couple of events and are close contacts from those. So the city in its news release put out the reminder about the 3 W's again. Wear the mask, watch the distance, wash the hands, what they call avoiding the 3 C's, crowded places, close contact settings, and confined or enclosed spaces. Testing times at Alanka are Mondays and Fridays from 2 to 3, Saturdays from noon to 1. Cordova Community Medical Center tests Tuesday, Wednesday, and Thursday in the morning from 9 to 9:30 a.m. They do ask, both facilities ask that you call ahead to arrange things. And we will continue to provide you briefings in the 1, 5, and 8 p.m. hours on the radio, and also uploaded to youtube.com/Cordova TV as soon as we can get them up there. Everybody be safe. Remember, the key thing to avoid to keep the spread under control, the most important factor is not interacting with people outside of your household to the greatest extent possible. If you need to, then masking and social distance, very, very important. But the very best way to stay safe, again, is to minimize contact outside your household. That's the guidance that's coming from the local and the state officials on a routine basis. That's what most of the spread in Alaska has been about for the last several weeks. So we wish you the best with that, and we will get back to regular programming on the Clam and the Eagle.